Okay, good morning, everybody. Welcome to the October 20th Paramedic Services Committee. Today we have one item on our agenda, and it's going to be the budget for today. So attendance has been taken, and noting that everybody is present, so thank you for coming today. We'll go to item 2, and that's the approval of the agenda. Can I get a mover for that, please? Moved by Councillor Pierce, second by Mayor Bailey. Anybody have anything they wish to add? Seeing none, all in favor of the agenda. That'll take us to item 3, declaration of pecuniary interest. You know what to do at the appropriate time if you have one. Delegations, petitions, presentations, we don't have any. Even when we get to the staff reports, we're not going to have any presentations on that, but if there's questions of staff, I'm going to ask that you do so at the appropriate time. So that'll take us to item 5, adoption of the minutes from the previous meetings, noting that we have Paramedic Services Committee meetings from 3 previous meetings, September 10th, 17th, and 29th. So can I get a mover, please, to get that on the floor? Before we do that, Councillor Hunt, did you have a question?
No, I can move it to get it on the floor,
okay.
But I did want to speak to it as well.
Yeah, absolutely. Okay, can we get a seconder then? Mayor Bailey, thank you. Okay, go ahead, Councillor Hunt.
Yeah, so they're on the floor. I wanted to speak to the minutes of September 29th. The minutes show myself as absent. I did respond that I was not available to the meeting invitation, and I can't speak for Councillor Martin or Mayor Davis, but the minutes as they're written look like we were all absent. So I certainly had sent regrets.
Okay. Mayor Davis, Councillor Martin, since you were mentioned.
Yeah, I sent regrets.
Okay.
Prior to the meeting.
Councillor Martin?
Yeah, I didn't see how I was referenced in the minutes, but I indicated that I was unavailable for that before the meeting was even set.
Okay. Can we, with committee's indulgence, we'll do that then. We'll change that from absent to regrets. Any other comments or questions then on those minutes? See none? Oh, go ahead, Mayor Davis.
Yeah, I'm a little bit concerned. This is a joint committee. It requires a level of partnership and trust between us, and I'm really quite, I'll just say, disappointed with the way that was handled and the comments that were made that were derogatory towards the city members. And I'd suggest that an apology is in order to rectify that.
Okay. I guess I'll apologize on behalf of the committee. I don't think I made any derogatory comments, but I'll gladly offer an apology. And I think what you're saying is, could it have been handled better? And I think it could have, but I don't want to delve in that today, if that's okay. But on behalf of the committee, I will offer up my apologies for that. So, okay, any other comments or questions on the minutes? Okay, seeing none, all in favor? Opposed? Any business arising from the minutes other than what we have before us today? There shouldn't be. Okay. There's 2 staff reports. The first one is 7-1, and that was a request for additional information. That was in relation, that's item 7-1, and that was in relation to what if we defer. There was 2 questions that were arise, pricing things out at 8.5 ambulances, and if we were looking at if we could defer the lease payments in Grandbridge. So staff did do that. They delved into the numbers. So this is just for information. So let's get a motion to get it on the floor. Can I get a mover? Councillor Pierce? Can I get a seconder? Councillor Martin? Cindy did do a presentation at the last meeting. I don't know if it was watched by all. I watched it myself again. But is there any questions of staff on any of those numbers? I thought, okay. See none, can I get, okay, so we got it on the floor. All in favor of receiving those numbers as information? 7-1. Okay, all opposed? See none. Okay, so this takes us to 7-2, Paramedic Services 2026 budget update. So, and then it says belated, and I thought that was an interesting use of phrases, but that is the word, a belated budget item. So in this one, we're asking for two things. We wish to receive the update, and that's the belated budget items. And there's 3 of those. And if anybody has any questions of staff about why those budget items have found their way into the budget today, please ask. And then the second part is that committee provide direction approval of the 2026 base budget and capital budget as presented. And we can certainly separate those items, but we'll see if we can't get a mover to get it on the floor. Item 7.2. Okay, Mayor Bailey, need a seconder? Get it on the floor, okay. Yeah, we'll go with Councilor Martin. Okay. Does anybody have any questions or comments on what's before us today? And that's item 7.2. See none, I'm going to call the vote. Oh, very good, very good. Almost lost on the pitch.
Okay, so on this, but just to clarify, Mr. Chair, so on this budget item, we're voting to receive or we're voting to approve? Just to clarify that for me.
We put them together. To receive was for those 3 budget items that
Yeah.
did not make their way in, and one was, well, you've read them, the lights, the lease costs had to go up a little bit, and one other item, the oxygen, the suction thing, yeah.
Okay, so first I'm going to I'll try and be diplomatic about it. You know, I was disappointed that in the first go-around that we didn't have the information regarding the impact of development charges. I mean, it kind of showed a sort of a disregard for the fact that we're a joint partner, and, you know, an effort wasn't made until we insisted, and until I also did some inquiries back at City Hall. So I was, again, disappointed about that. But I'm also disappointed that it was clear from the last set of meetings that the city members are interested in seeing the budget numbers in 8.5, which is maintaining the current level of service. And I don't see that in here. It's all the information we've been given in the update, which, by the way, does include some additional costs because of leasing garage space, hasn't told us what the impact of maintaining the current level of service is, the 8.5 ambulances. I guess my question is, can staff give us what the relevant numbers would be?
Yeah, the budget presented is based on the 9. The numbers in 7.1 were based on the 8, or we're showing the 8.5, but we didn't see it with the development charges for the city included, and with those 3 additional belated budget items. Heather, would you be able, did you have those numbers available for an 8.5 versus a 9, with everything else included?
Through the chair, yes, I do have the numbers for 8.5. It would bring the net levy increase to 15.4%.
And that's the combined 15.4%?
That's the combined, yes.
Yeah, okay. And if I broke that down to city, county with the DCs in there, would you have that available?
The DCs for the city portion would go to 9.5 and the county to 9 even.
Okay. And that's at 8.5.
That's reducing it to 8.5, yes.
So those are the numbers.
Sorry, and so that's, so 9.5 to the city, and that's taking it from, is it 10.7 at 9? Also working in the development charges?
What, could you rephrase, please?
Yeah, so you've given us a number of 9.5, the net levy increase for the city. That's with 8.5, working in the 3 additional charges, and then backing out the adjustment for development charges.
Correct.
Just asking if you could confirm for me if it's at 9, the budget as proposed, is that 10.7 increase in the city levy?
If we're looking at.
No.
if we're looking at, page 17 of the report, of our package, page 3 of 5, change with DC funding for new lease, 10.7 for the city, 10.2 for the county. That's at 9.
Yeah.
Where do we get the 11.9 though?
This is the updated numbers.
Oh, the updated numbers, I'm sorry.
Yeah, I think that's the number.
Page 1 of 3 of 4. Oh, I see. Okay.
Most recent report.
I had all these numbers.
So sorry, in the 9, for the 9 ambulances, with the DC charges, no deferral of the lease, the city is showing 11.9% and 11.4 for the county.
Okay, and if we look at our package, yeah, it is in there, so it's, you'll see that on page 27 of 34.
And if you could tell us what the, so if I understand it correctly, it's 11 point, I'm talking about the city net levy. So it's 11.9 at 9 ambulances. And if you add in the deferral of leasing costs through a revised agreement with Grand Bridge, that gets it down to 10.7?
That gets us to 11% even for the city.
Okay.
Yep, 11%.
And what is the numerical difference, the number difference between 11% net city levy and 9.5? The dollar amount.
$113,000.
Okay, thanks. Thank you.
Okay, any other questions for staff? Yeah, Councilor Martin, go ahead.
Yeah, I'm looking over the numbers for the lease deferral, and it looks like we're deferring $250,000 for 1 year, correct? Why is the number different in 2028? What's that?
What page are you on, if you don't mind me asking?
Actually, I had to go back to the previous report. It's page 4 or 5.
Okay, that's 7-1.
Yeah, in 7-1. Sorry, Mr. Chairman, but need to understand that in order to move forward with the budget.
Through the chair, the deferral is a 1-year deferral of $250,000 to be made up over the next 2 years. And then we're back onto the regular lease payments. So that it's an immediate repayment of that deferral.
Okay, but it looks like the deferral gets paid in 2027, the $250,000. Am I not reading the numbers right?
Sorry, the deferral, the $250,000, the lease was decreased by $250,000 in 2026. $136,000 is paid back in 27, and a further $136,000 is repaid in 2028. Both of those numbers have interest included in them.
Okay.
Yep. And for total interest of 22,000, so. Councilor Martin?
Yeah, there's, something doesn't look right in the numbers. Okay, thank you.
Okay, we'll go back to Mayor Davis.
Yeah. Sorry, I don't know the button system here. It's green light, so I guess I'm good. So with that, through you, Mr. Chair, to the Treasurer, Heather, isn't there a downside to deferring the leasing costs? And that is, isn't the approach that in the second year, the province picks up more of it, right? The first year, they only really pay about, well, less than 40%. But the second year it's in the budget, the expectation is it'll be closer to the province picking up 50% of those costs. That's kind of the rationale, isn't it?
It does, through the chair, it does move the provincial funding over. It would spike the increase further in 2026 on the tax base, but yes, it would kind of spread out out the provincial funding. I'm not sure. Yes, it's a moving
So
funding.
if we defer the lease, we're also deferring, to some degree, the province catching up and paying 50% of
Correct.
those costs.
Correct.
Okay.
Yeah, my understanding is we have the interest charges of 22,000, but we have also lost some of that lease payments from the province. So there is a bit of a cost to that. There is. Any other questions? Okay.
I just did the calculation, and the increase for 2027 is 261,000. So that includes the full 250 plus part of the interest payment.
And if I look to Heather, I believe that's,
Through the chair, the increase in 2027 is also including the full cost of the garage that wasn't, like, it's only partially from August to December. We're only paying for the garage. It will be, fully, so we're paying for all the admin and all the garage in 2027. So it's not just,
That has nothing to do with the deferral. I'm looking at the lease deferral and the no lease deferral lines. There's a difference of 261 in 2027, which means that we're fully paying back the 250 that was deferred, plus some of the interest.
I'm sorry, I do not understand what you're looking at.
7.1, page 4 of
Counselor
5.
Martin, hold on one second. You're on page, give us a page
Page 4 of 5
of the report.
of 7.1.
Okay, 7.1.
The bottom of the page, there's lease deferral and no lease deferral. And the difference in 2027 is 261,000. We're paying an extra 261,000, so that fully pays back the 250 that was deferred, plus at least some of the interest.
I can speak to it if you want. Through the chair, I believe the 2027 numbers, this is showing the whole net levy. It's not just showing the specific lease payments.
The chart is supposed to be a comparison between lease deferral and no lease deferral.
Correct. It's showing the forecast for the next 3 years.
Yeah.
If there is a lease deferral next year of $250,000,
Yeah.
but it's showing the impact for the entire budget, right? So that's incorporating provincial funding, it's incorporating a year of introducing the new garage space partly next year, and then in
But
2027.
introducing the new garage space should be included in both lines. You're introducing the new garage space, whether we defer the lease or not. This should be a direct comparison between what the payments are if we don't defer the lease and what they are if we do defer the lease. If you throw other things in there, it's meaningless. You might as well just grab numbers out of the air.
Counselor Martin, they're not grabbing numbers out of there, but there's there's other factors, I think, that are playing into it. I think what staff was doing is trying to capture the whole impact of that.
Okay.
That's my understanding.
But saying that you're bringing in the lease of the garage in one and not the other doesn't make the numbers make sense.
Mr. Chair?
Like,
I'm not sure, I know they're working on it there, but could it not be the fact also, if we're deferring $250,000 in lease payments, that brings what we're getting back from the province down by approximately $125,000 in the next year? So I think that's making up your difference right there, because we wouldn't, that $250,000, we're supposed to get half of that back from the province, which we would not be now. So we've got to come up with that extra $125,000, in essence, or 42% of the 250, which is going to be your numbers.
okay, now that makes sense. Talking about introducing the garage should have nothing to do with this. So thank you, Counselor, for the explanation.
I think that's part of it, but, okay. Appreciate it. No, you're absolutely right, you're absolutely right. In that, in the lease, sorry, the interest costs are as well, so. All right. Mayor Davis, you had your hand up, so. Yes, and I said we would clear up Councilor Martin first, but if,
Question was answered.
okay, fair enough. Okay, any other questions? Okay. I'm gonna call the vote. We almost got there last time, but there's a couple of questions that come up. Go ahead, Mayor Davis.
When you say call the vote, you mean call the vote approving the budget of 9 ambulances,
Correct.
right?
Yes.
Okay.
All in favor?
So, well, hang on, I'd like to make an amendment.
Oh, yeah, this is the time to do it if you.
I know this is time to do it, and that's why I want to do it. So, first of all, couple of, if you give me a little bit of latitude, I'll explain what it is I'm trying to do. So, I think we have, between the position that has been taken by the city members, and I can't speak for both of them, but I think I understand what their position has been, which is very similar to mine, which is that, you know, paramedics, they do a great job. They provide an absolutely critical service. But, you know, this cost increase of 90% over 5 years, it really is not sustainable. And fortunately, we're moving to this dispatch system, which I think will really have an impact on the demand. The budget at 9 assumes it won't. So we've been looking at 8.5, which is maintain the current level of service. The county members at 9. We did this before when we had a budget deadlock. Mayor Bailey, I think you'll remember, about 6 years ago. And we found a compromise. Actually, I think you proposed it. So I'm going to propose a compromise which would in essence have it at 8.75%. And I haven't got the full wording in my head, but it would be that the move to 9 paramedics would be deferred until September 1st, which I think is like 8.75. And that the decision to go from 8.5 to 8.75 would not be finalized until the June Paramedics Committee meeting, where we will then have available to us up-to-date data about call volumes, and we'll be able to see the impact, at least over the first 7 months, the impact of the dispatching priority system. But still, you build the budget on the assumption that you're going to be proceeding with going to 9 in September, but you still defer the final decision to actually do it until June. So I'm sorry that I'm not being precise with the with the motion, but I was actually thinking about it as I drove here. So that's what it is. So going to 9 paramedics September 1st, and that decision, the actual decision to implement the increased 0.5 to 9 would not be finalized until the June Paramedics Committee meeting. But the budget for tax collection purposes would be set at the 9 commencing September 1st.
Okay, I'm just gonna clean up your language a little bit. You said.
I appreciate it.
You said go to 9 paramedics. I think you meant go to 9 ambulances.
Yeah, I'm at 9 ambulances, correct.
And I think we did do that for this year we delayed it a bit, but, so, and then that would take effect September 1st, 2026. conditional upon final approval at the June paramedic services meeting. Is that fair?
Correct.
Okay, that's the amendment.
Looking for a seconder.
Yeah, you need a seconder for that one?
I'll second that, but I think the date should be October 1st. That's the start of the quarter. By moving it a quarter, it essentially takes the.
This could be a friendly amendment to the amendment.
Friendly, I think 8.75 would be October 1st.
Yep.
Okay, that's the amendment. I'm gonna have the clerk read it back, and then we'll clear up the language if it need be. If the mover and second are okay with the language, then we'll discuss. Yep. Go ahead. We may not have, if this goes through, we probably won't have the final numbers until afterwards.
Through you, Mr. Chair, I believe I've captured it correctly. So the amendment would be that the last clause be struck and that the following be added, that the base operating budget be based on 8.75 ambulatory service units to be finalized to a total of 9 ambulatory units commencing October 1st, 2026.
Halfway there. So what I'm getting at is, for the purposes of determining the mill rate for 2026, you have to have a finalized budget, right? And so that would be going to 9 ambulances October 1st. But the actual decision to do that, to move up to the full 9 ambulances from 8.5, would not be made until the June Paramedics Committee meeting. So it's like including in the budget an operational decision, but also the budget decision.
Okay, bear with me here. So just to amend that the base operating budget be based on 9 ambulatory service units to be finalized to a grand total of 9 on October 1st, 2026.
No, the base budget would be based on 9 ambulances as of October 1st. So that's what the base budget would be. But the actual implementation of going from 8.5 to 9 would be conditional upon paramedics committee approval at its meeting in June. So, Mr. Chair, the end result would be if we decide in June not to go to 9, I mean, there'd be a budget surplus in the department for 2026, but that's, that's fine. But for the purposes of setting, the tax rate for 2026, we need a fixed base budget.
Yeah, and not to ascribe contingency, but it sounds like if we look at it at June, we'll have more data to work with.
Exactly.
That's.
Okay, sorry, let me try again. So that the paramedic services budget be based on 8.75 ambulatory units with the final recommendation to fill the enhancement to be considered in June 2026.
Almost there. I think you really have to say you're going to 9 ambulances as of, the base budget would be based on going to 9 ambulances effective October 1st, which, if you step back, that's essentially 8.75 for the year, I think. But, so your base budget is based on 9 ambulances as of October 1st. But the decision to implement that for operational purposes would not be made until the June paramedics meeting.
Okay. Here's my last try. That the paramedic service budget be based on 9 ambulatory units with a start date for the enhancement as of October 1st, 2026, with the final recommendation to fill the enhancement to be considered in June 2026.
Yeah, I think that captures it.
Thank you.
Thank you for that.
I think we got it worded. Counselor Martin, seconder, you're okay with that? Okay. That's the amendment. Comments, questions, concerns? Counselor Pierce?
Thanks, Mr. Chair. So, again, if we're doing quick math here, if we said earlier that the difference between 8.5 ambulance and 9 ambulances was $113,000 difference for the city, if we break this down then, we're talking about $84,000. In essence, so if we were to do it in October, it would be additional $28,000. I'm trying to understand the rationale, and I know we said that we would put it to the June meeting to understand how the new system is helping response times, when we know we've been over it a few times, it does not help response times. It does not lower the number of calls that come in. It prioritizes them. So we're going to be sitting here in June stating the fact that our call volumes are, I'm assuming, that our call volumes are still going up, but we are prioritizing them now. There's some people that are waiting longer for an ambulance. So hopefully they get the idea that for a stub toe, for a scratch, for this, take yourself to the clinic, hopefully. But I'm not going to hold my breath on that, because as we've seen in the past, we've tried to educate the public on that. It's not happening. So I just want to be clear here. So what we're talking about is breaking that $113,000 difference down in, so it's only $28,000 as opposed to 113, or am I getting that wrong?
That I don't know, because I haven't punched the numbers, but
Mr. Chair, I'm just going off of what was said earlier, that the difference between 8.5 ambulances and 9 ambulances for the city portion is $113,000.
it's going to be close. We'll circle back to that question, okay, Councilor Pierce. We'll go to Councilor Hunt next, and then we'll go to Mayor Davis, because he's working on a few things. Councilor Hunt, go ahead.
Yeah, so through you, speaking to the amendment, this is similar to what we did last year, where we went from 8 to 8.5, but we deferred the implementation to 8.5 to partway through the year. And recognizing the fact that next year is a tough year for this budget because of the leasing costs. And so whereas we are, we're deferring and, fix a dollar figure on it or not, but we're still coming into both the city and county estimates meetings with a double-digit increase regardless. And so I think precedent was set that we did this last year. We went from 8 to 8.5, but we did it halfway through the year. And I think this amendment is basically speaking to the same, that we're at 8.5, but we're agreeing from the base budget perspective to go to 9 in October, which is, in the fourth quarter versus just saying we're staying at the 8.5, but we still have the reality of the very expensive leasing costs, whether they're deferred or not. We still have to pay those. So I'm supportive of the amendment. I think it gets us to 9. It just doesn't get us to 9 on January 1st. That's the difference.
Okay, Councilor Hunt, thank you. I do have to correct you on that. We didn't go from 8 to 8.5. We were at 8.5 for the year. We were supposed to go from 8.5 to 9 this year in 2025 on July 1st. Just, so I want to clear that up. And that was delayed until, help me out here, Cindy.
Through the chair, we've delayed that because of budget pressures this year. We're trying to mitigate a deficit this year, as well as some staffing constraints that we've had. We are trying to hire some additional part-time staff in order to essentially have enough staff to move into that additional 12-hour vehicle.
Okay.
And it is now
so-
on pause because of budget discussions.
Okay, so through the chair to staff, okay, maybe I'm missing a year. So was it the 2024 budget that we deferred because at one point we went from 8 to 8.5 partway through the year.
When did we actually go to 8.5? Do we know? I know we were
For
at
some reason,
8.5 for the
March.
whole year. But yeah, like we say, that 9 was actually approved in 2024, to take effect in 2025. And as, General Manager Stevenson pointed out, that was delayed until September 1st, and now it's been pushed off again because we're going through this budget process. So it has been approved at one time. Go to Mayor Davis.
I understand the concern expressed by Councillor Pierce, which essentially is it's not a huge amount of money, but there's more to this amendment than just dollars, right? There's three purposes. One, it's a compromise position which shows the world at large that the city and the county can work together and they can find solutions when they have differences in approaches or differences in respect to the budget. And the only way you get there is through compromise. Secondly, once you go to 9, it's baked in for 2027. And that's a huge number for 2027, much more than it is for 2026. I'm trying to look at this as on a 2 or 3 year time frame, and that it is different than what we've done in years before, because what was done in years past did not have this tie-in, which is the actual decision to do it to be deferred until later in the year once we have more data. We know there's been a change in the trend of call volumes in the last 6 months. We're seeing less wait time at the hospital. I know it bumps up and down, but generally the trend is towards less wait time. We know we're doing the triage dispatching system in November. So there's 2 factors at work here that I think we'll have a better idea, better handle on where the demand volume is going in June. But you know, if you approve a budget that unconditionally goes to 9, whether it's June 1st, May 1st, October 1st, it's baked in forever, basically. Because then to move back from that position in 2027 or 2028 would be a cut in service. And believe me, that's pretty hard to do politically, so.
Okay, thank you.
Those are the reasons.
Yep, no, you made the motion, you've spoken to it. And I think Councillor Pierce raised some objections, which you responded to. Does anybody else have any comments or concerns or questions about the amendment? Does anybody want that amendment read back? Councillor Pierce.
Thank you, Mr. Chair. If I could, I just want to comment on if we go to 9, then it's baked in. I would tend to disagree with that because we were supposed to go to 9. The decision was made in 2024 to go to 9 in 2025. So in essence, with the comment saying it was baked in, we should be there, but we're not. We're still at 8.5, which puts us over 100% capacity.
Okay. Your vote is a no on the amendment. Okay. Councillor Martin.
Yeah, I think the mayor's point was that once we go to 9, it's almost impossible to reduce that. Nobody's going to support a cut in services. The fact that it got delayed, and I don't remember that coming to this committee, I must have missed that, but the fact that it got delayed just shows that we need to take seriously adding additional services. And if it was paused in 2025, then we need to consider that maybe it still needs to be paused until the 3rd quarter of 26.
Okay. Any other comments or questions? Okay, I'll call the vote on the amendment. All in favor? Opposed? Okay, that's carried. Now we go back to the original motion. We have it moved and seconded with an amendment. Any other comments, questions? See none, all in favor? Opposed? Okay, noted. That budget will go to the the two municipalities. Then we go from there. Communications, we have none. Other business, nobody raised their hand. So we will meet again very soon, next month, November 19th, and I'll call this meeting adjourned.